Now, as you know, we're getting age is one of those risk factors that we spoke about, and people are going to their 70s and 80s and 90s, and we're dealing with arthritis, osteoporosis, and all of those are also risk factors that's involved with back pain. There's another very good question that came, I believe it's a patient from California that talks about, the effect of arthritis and how that kind of lead to this back pain. Maybe we can put up the question and we can talk about it. She is suffering from arthritis, and over the time, she has severe back pain. What do we tell those patients that have arthritic issues?
Another big problem, as we age with the normal loading of the spine and the wear and tear, the joints in the back oftentimes become arthritic. These joints that move in the back, called the facets, the disc can become arthritic, and that can lead to chronic back pain. Sometimes the arthritis gets so large that it chokes off the spinal canal and causes spinal stenosis. That's relieved with injections in the back and therapy or with surgery. Other patients just have arthritic pain from the joints itself. We usually advise swimming, Pilates, core strengthening, Motrin or Advil, visits with a chiropractor or physical therapy. We don't typically operate on general arthritis of the back.
But I got to tell you, Sean, a lot of times, and including my own mom, went for epidural injections.
Yeah.
They get a very short relief from that, and then all of a sudden, 4 months later, 3 months later, it's back. Mm-hmm. She actually went for 2 or 3 of these injections, and you get a. I'm not saying epidural is not good for you, but there's certain room for it, but a lot of times these are not cure. Is that fair to say?
That's fair to say. What the epidural does is, through a small needle, we put a little cortisone and medicine into the spinal canal. What it's very good at is taking inflammation away from a nerve. So if you have a nerve that's pinched and swollen from a piece of herniated disc, it can calm that pain down very nicely. However, it doesn't fix anything, so the pain can come back. If the disc doesn't shrink and go away, the pain will come back. In the case of arthritis, the epidural does not fix the arthritis. It temporarily takes away inflammation. You feel better, but inevitably the inflammation comes back and the back pain returns.